Hi, my name is Ben Mol. My full name is Ben Willem Mol, but I made it short. I'm coming to Australia. I'm a professor of Obstetrics Gynaecology who works in the Department of Obstetrics Gynaecology, School of Medicine, Monash University. And I also have a small appointment with Monash Health, where I work in fertility care. And apart from that, I have an affiliate position at the University of Aberdeen in Scotland. So my area of research is women's health. I'm in the evaluation part, so kind of a destiny I have in life that I never come up with an innovation. I only evaluate what others claim is working. And usually we find that it's not as good as people think it is, which brings in a little bit of tension. And I do that in the whole width of women's health, so obstetrics, but also gynecology, infertility, and oncology. And I consider my core business as making medical knowledge. If you ask me about breakthroughs, then I think I have reintroduced three things on the clinical and research agenda in my field. That is induction of labor with a balloon, that's a mechanical device that opens the cervix while everybody was using a medication for that. And I think a balloon is safer. The second thing is I have reintroduced the use of pessary, which is a mechanical device in the prevention of preterm birth. So that's a device that is already 60 years old, but it was not used until we did our studies, and then we found it actually was pretty good. And the third thing is in infertility. If you're struggling with getting pregnant, we have found that if you make an X-ray of the tubes and you flush the tubes with contrast media to get it open or to make it visible, that increases also the pregnancy rates. And it was something that was also known from the past, but people have forgotten about it. And we have published a big paper on it, published New England Journal of Medicine, that has reintroduced that on the clinical and the research agenda. In general, we evaluate, which means that we find out what works and what doesn't. And that is important because there is quite a substantial number of medical interventions that are currently applied where we actually don't know if they are helping people. And tax money is used to pay these interventions. These interventions generate side effects, mild, but sometimes also serious. So it's really important to know which interventions really work and which do not. And that's, I think, in the core of our research. So we keep medicine effective, safe, and accessible. Monash has supported me by providing an infrastructure to work in. I think Monash within the Australian setting is great in bringing the health system and the university close together. So my office is actually in one of the Monash Health hospitals. And it's great because that infrastructure helps us in doing journal clubs with registrars, being involved in guideline meetings, which is both important to implement what we know, but also to understand better what we have to evaluate.